Hello everyone, Dr. Philip Fowler here with Anti-Aging Northwest. Just wanted to touch base tonight on a question I was most asked today during clinic. The number one question I was asked today is, why do we use HCG? So I wanted to touch base on that. There are a couple of reasons. We use HCG in a couple of settings, but in the setting I'm talking about is with a male testosterone replacement program. We use it as an adjunctive therapy. The reason we use HCG, cosmetically, it prevents the testicles from shrinking. So if we're using testosterone and the testicles are not being called upon by LH and FSH to produce testosterone, then the testicles are going to shrink. So that's one reason. Nobody wants their testicles to shrink. Reason number two is by stimulating the receptors on the testicles, on the Sertoli and the Leydig cells, we are going to increase the amount of testosterone production coming from the testicles, possibly a little bit of sperm production. It's pretty well shut down when you're supplementing with testosterone. Don't use it as testosterone replacement therapy. Does not count as birth control. But stimulating those receptors causes a chemical cascade, keeps the whole body on board with the fact that we're raising testosterone levels. And clinically speaking, that has proven over the years many times to me. Patients report to me better sexual function, better orgasms, better ejaculatory volume, all those things. When you're just using testosterone, those things can drop in time, and when you're pairing it with HCG, then we tend to be able to maintain those things better. So I hope that's helpful, and I hope that answers the question. Hope everyone's having a great evening, and thank you so much. Stop by antiagingnorthwest.com if you have more questions and schedule a free 10-minute consult.